Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Hey team, I'm Dr. Trista Hutchinson, occupational therapist here with the Modern Management of the Older Adult Division, brought to you by the Institute of Clinical Excellence. And I am super excited to talk to you guys today about 6 scenarios that a physical therapist should refer or collaborate with an occupational therapist. Now, I know PT, OT, PT, there is a ton of gray area. We are no longer using that really outdated siloed approach where OT does upper body, PT does lower body. That is no longer our approach. Okay, as a result, there's a lot of gray area. So I'm going to deep dive into today, again, 6 scenarios where a physical therapist should refer to or collaborate with an occupational therapist. In an ideal world, yes, our patients would have both, right? And not or. PT and OT, not PT or OT. In an ideal situation. However, that's not always the case. Sometimes our patients come and they only get PT or they only get OT. But when you're working with them as a physical therapist, the first situation or scenario that I want you to really consider and strongly encourage you to refer to an occupational therapist is when there's any sort of cognitive challenge, cognitive concern, or anything cognitive related on board. Okay? So what I mean by that is I want you to ask your patient a couple of questions, quick screen questions. Are they alert and oriented? Do they know what day it is? Are you noticing they're being a little repetitive or they're not remembering something you maybe talked about last session? Any sort of scenario like that, refer to an OT. Why? Because knowing your patient's cognitive level is extremely valuable. Knowing your patient's cognitive level is extremely valuable. Meaning, if your OT goes in and completes a comprehensive cognitive evaluation, they can then provide you information such as your patient is in Allen cognitive level 3.4. What that means is that your patient will not remember if you hand them a home exercise program. Your patient will not listen to your cues if they are more than 4 to 5 big phrases or cues all mixed in one. Meaning, if you tell your patient, walk over there, go around the cone, come back here and sit down, that's probably not going to work. You're going to have to show them. You're going to have to cue them. You might have to count down with them if you're trying to do some sort of a standing balance test or something like that. So knowing your cognitive level is super important. Again, that can help you with cues during your session, that can help you with developing home exercise programs or knowing that you need to talk to family about helping with home exercise programs that are realistic, knowing that handing your patient a piece of paper that they're going to walk out the door with and then forget about, or they might even leave it on the waiting room table because it's out of their mind completely. That's super valuable information, right? Knowing someone's cognitive level also is super valuable when someone is transitioning to a new environment. OT can be really supportive and helpful with making that transition smooth so that if you're working on something physical with maybe their balance, endurance, strength, all of those things, OT can help the transition to a new environment be smooth. I'm particularly talking about like if someone were to move from an assisted living to a memory care or from home to assisted living, having the OT there to make sure things are smooth and comfortable can be really beneficial to the progress overall that you've made physically as well. Okay, so cognition. A million reasons why it's important to know cognition. However, just stick with cognition. So anything cognitively on board, refer to your OT. Number 2, falls. If your patient is referred to you for a fall or has been falling or has a major fall, I want you to strongly and I want to encourage you to refer to an occupational therapist. Okay. In these scenarios, occupational therapy is going to come in. They're going to help with assessing the environment. Okay. They're going to do an activity analysis of that patient, what they were doing at that time. And is it something that needs to be worked on necessarily because of their balance or the vestibular system or all of those things? That might be more of the PT eyes, while the OT is going to look at, is this just something silly in their environment? Like their bed is set up in a way where they have to walk over a bunch of cords and step sideways through a narrow pathway, and that's why they fell. And so you're actually making really great progress with them physically, and their balance and strength has improved, but their environment is just not appropriate. Maybe this is difficulty with their adaptive equipment. It's just not appropriate. Maybe they are having troubles with adhering to their medications. Okay, that could be a big challenge too. And so they're not taking their medications appropriately, and so they are having a fall. Causing dizziness. Maybe their toileting schedule needs to be adjusted. One scenario that just happened recently with me and my therapy team, I had a man who was having repeated falls, and we're as a team thinking like, okay, like what the heck? What is happening? Because just over the weekend had a bunch of falls, and PT has been working so hard with this person on their strength and balance. OT as well, but we've been doing a lot of different occupation-based training in terms of like ADL sides of things and hygiene. And so I went in to see this patient, and I was like, okay, take me to the scene. This person happens to be very progressed in their current level of dementia. And so I had a caregiver take me in, and I said, okay, show me where the fall happened, what's the scenario, where's the patient, etc. Turns out that this patient falls always between 12 a.m. and 4 a.m. Okay, so we've narrowed it down. It's during the night. And this person, they're wondering if he tries to roll out of bed or what happens. And so I asked, well, tell me about his setup when he's sleeping. Turns out this patient has a catheter that he has a leg bag attached to his leg, meaning has like a little strap around his leg, which is then attached further to a bed bag for overnight use, which is secured around his ankle as well, per request of caregivers and family, which is then further strung and set into a bucket on the floor. They also have soaker pads on the floor underneath this bucket. And so picture this. So now if the patient tries to get up, it's the middle of the night, it's dark, he's confused, he doesn't remember to use his walker, he stands up, and now he's attached to a bag inside of a bucket by a cord he has to step over on a bunch of soaker pads on the floor. Okay, so we talked to family about removing the catheter altogether and using incontinence products, and they were totally on board. We talked about removing those soaker pads and understanding that it'd be more beneficial to keep the individual on their feet than to worry about the carpet, and that we have a really awesome carpet cleaner that we can suggest and help keep the carpets clean. And as a result, the patient hasn't fallen since, knock on wood. But that's a scenario where PT and OT collaborate. And so we can say physical therapy, all of those awesome interventions that you're doing right now, 110% keep going. They are working. We just put this patient in an environment where he wasn't going to be successful. So as OT, we can take the time to deep dive into those things. Okay, so we have cognition, we have falls. Next, physical therapy can really benefit from referring to OT whenever there's a mental health challenge with one of your patients. Okay, for example, leisure and meaningful engagement in just daily occupation, social activities is a part of the OT scope of practice. OT can, under their scope, spend time supporting and promoting engagement in meaningful leisure activities. For example, I have an individual who told me, there is nothing to live for. I have no purpose on this earth. I'm just existing. Now that's a heavy hitter. Okay, there's a lot of different interventions that we did to help this patient. However, one that really stuck and hit home with him was providing him a sense of purpose. I did a little further deep digging, and he used to be a farmer and used to love planting. Okay, so we got him set up with a couple of geranium plants that he could have on his porch, and he now every day, every morning has to get up and water those plants. We had another individual who was having difficulty with his overall mental health as well. We got him set up with a job at the assisted living facility he lives at, watering the plants on a daily basis. That now became his role, became his job. It also got him more active because he had a reason that he needed to walk around the facility. We had an individual who was struggling with her transition into memory care, and so we adjusted some music on the piano keyboard that was in the facility, and we changed the notes to numbers, and we put numbers on the keyboard, and then she was engaging in those things. And you should have seen the change in these individuals from start to finish in terms of their mental health as soon as they were engaging in something meaningful in their leisure activities. So we have cognition, falls, mental health. Next, I want to talk about meal preparation. Now, we know as physical and occupational therapists how important good quality nutrition is and hydration for progress physically and emotionally and all of the things. But physically, how important is that nutrition? Huge. Now, if you talk to your patient and they say, I have no appetite, I occasionally have a few snacks here and there. You ask them what they eat on a daily basis, and it's normally all carbs. Very few individuals are hitting their protein goal or even getting half of their protein goal. So pulling an OT on board that can sit down with your patient, talk through what is protein, talk through why do we want protein, talk through how to meal plan or make a grocery list, or things that we should, that we can prepare ahead of time, or when we should prioritize protein in terms of when we have our physical or occupational therapy sessions or our exercise routines. We can talk about that hydration as well to support our progress. Because if you are working with your patient over and over and over, and you're building that strength and you're hitting it hard and you're doing all the high intensity training and you're doing it great, awesome. But if they are not getting their nutrition and they're not fueling their body, A, they're not going to get the maximum benefit. B, they're also just not going to feel as great. They're going to be more tired, more worn down, more sore because they're not getting that nutrients to support their progress. Okay. Cognition, falls, mental health, meal preparation, planning, and self-feeding. Then I want to talk about medication management. Yes, in some scenarios, such as like home health, we might also be pulling nursing on board. For those of you that do not have access to consultant nursing on your team, I highly recommend occupational therapy. Physical therapists refer to your occupational therapist in this scenario. Recently, we just had an individual that our team has been working with, and the physical therapist came in and was talking to me, and she's like, hey, I noticed that so-and-so today was having a really hard time with following directions and concentrating, and that is not normal for her. I did happen to glance at her meds, and something looks a little bit off. Okay, so that was a great conversation and collaboration moment, which led me then my next session to reassess the patient's ability to manage her medications. Turns out she had a UTI, but was taking her medications incorrectly because the UTI was making her more confused. Okay, so now physical therapy is working so hard on these strength and balance things. Occupational therapy is also throwing those strength and balance interventions in with more of that occupation-based lens, but we're not getting anywhere because a UTI now is on board, and we're not being able to mitigate that UTI with the medications because the patient's not understanding the process. So occupational therapy worked as a team, came up with a system to make it foolproof for this patient, to make sure that she was taking her medications on time, kicked that UTI to the curb, bada boom, bada bang, progress back on track. Progress back on track. We've had lots of other patients, they're talking about their medications, blood pressure's kind of iffy, up and down, and they think they're taking their meds, they're not sure. They've got all their pill bottles out on the table. They kind of have a system, but it's not foolproof. So occupational therapy, under their scope of practice, can spend time with health management and medication management, educating the patient, supporting the patient in finding a routine that's going to be most beneficial for them. So super, super helpful for physical therapy to consult and refer to occupational therapy for that medication management. Again, to make sure the patient's progress is streamlined, getting their maximum benefit. All right, guys, we have talked about cognition, falls, mental health, meal preparation and planning, medication management, and lastly, I just want to touch on adaptive equipment. I'm not talking about walkers, wheelchairs, canes, the assistive devices that we use for ambulation and functional mobility. I'm more so talking about the creative, nitty-gritty, hey, if so-and-so's really struggling with this random task, they keep talking to me about it, do you have any ideas? Yes, we want to always push our patients towards the maximal level of independence possible, but sometimes we need a solution right now. We need a solution right now. So, for example, I was working with an individual and her grip strength was so low that she could not push down her inhaler to take a puff of her medication. She could not actually push the lever down and take her own medication. Yeah, and this person's oxygen level with any form of exercise between 30 seconds to a minute, and her oxygen level will drop to the low 80s, even to 78%. Her provider did not want to put her on any sort of supplemental oxygen for fear of fall risk because she was already falling very frequently. Okay, so she had the inhaler to support her, a bunch of nebulizers as well. But what we did as OT is we actually got super creative and consulted an engineer who developed a device that helped support the patient in pushing the inhaler down independently. And we got her to do that on her own right away. Okay, so we use that adaptive equipment to get a solution right now, while still focusing on building grip strength, endurance, stamina, all of those things, but she at least had access to her medication right now. There's so many different creative and supportive different devices out there for assistive technology. Occupational therapists know a million things about modifying people's phones, providing visual aids, different things for buttons, for utensils, for clothing, all of those different things. There's so many options out there. I highly recommend referring to an occupational therapist for any sort of that creative adaptive equipment. We have extensive training on this in school. That's one thing that is kind of our big guru. We have a lot of assignments and tasks where we have to really focus on those things, and so that can be really supportive. All right, team, 6 scenarios and reasons, case examples of when a physical therapist should and is highly encouraged to refer to and collaborate with an occupational therapist. We talked about cognition. We talked about anytime there's falls, mental health challenges, meal preparation and planning, medication management, and adaptive equipment. I hope that this brought some light to that gray area that we have between PT, OT, who, what, when, where, why we need to support and use each other to progress and streamline our patients' progress. But awesome. Thanks, folks. Have a great evening.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.